The gentleman from Texas, Mr. Arrington, is recognized for 5 minutes.
Mr. Chairman, thank you, and I'm honored to represent West Texas. I'm honored to be on this committee, and to the ranking member, Mr. Yarmouth, I look forward to working with you and your our colleagues on the other side of the aisle. The jury isn't out in West Texas on Obamacare. Never, and I've been around public policy and politics a long time, never has there been a greater disparity or irony between the title and intent of legislation and its outcomes for the American people. It's not affordable care. It's the Unaffordable Care Act. It is the Raise $1 Trillion in Tax on Americans Act. It is the Kill More Small Businesses and Jobs Act. It is Crush the American Economy when it's coming up for air from the Recession Act. It's weaken the Medicare Act by taking $800 billion from that program. It is make it more difficult on middle class and working class families. Let me tell you something. In West Texas, we don't care about the names on the halls and walls of Congress. We care about the people that have their names on their shirts and on the back of their belts, and they're getting creamed. How serious is this that we act now, that we act swiftly and with confidence, that this paradigm, that this top-down, government-run, centrally planned, one-size-fits-all health care has failed us? How urgent is it that we act? How serious is it that we act? Ms. Turner.
Absolutely crucial, and a new system cannot be built on the wreckage of Obamacare. You have to repeal it first. That's why members of Congress could not replace legislation because the president vetoed the repeal bill.
Other members of the panel.
It's clear that simply repealing the ACA will not bring back the system that was destroyed by the ACA. That previous system also had a lot of problems with it. And that this is an opportunity to create a more caring and more feasible and more affordable and more economically rational system in which people can actually obtain the care they need instead of just obtain their $9,000 deductible.
See, I'm just a freshman congressman, you know, and I'm trying to make sense of all this and this alternate universe and facts that have been mentioned, and I see the American healthcare system as a patient on the operating table in the emergency room bleeding out, and we're expected to take an ACE bandage and an aspirin and somehow allow it to live to see another day. And the people I represent don't believe that. I'm not disparaging or questioning the intent. The intentions were to provide affordable care. The outcomes were that it didn't, period. And it's only the responsible thing to do for those who lead our country and represent the good people of these United States to step in and do something and provide solutions, real patient-centered solutions, market-oriented solutions, flexibility to states, empowerment of the patient to actually be a consumer of health care and create real markets where health insurance companies are competing for our business, driving the cost down and quality up. Good old-fashioned free enterprise American way. And I come from middle America. I come from rural America. And as I said on the floor the other day, when America's sick, and believe me, the folks in the 29 counties in Texas District 19 would reaffirm this statement. When America's sick, and they're sick from Obamacare, and they're sick of Obamacare, and they're sick of big government being thrust upon them as the solution for every problem that ails us. But when America's sick, rural America is in the ICU. Small businesses, family farms, community banks, rural hospitals. Put the slide back up, please, if you would, of the 80 rural hospitals that have gone away. 600 on the brink of going away. How are we going to bring the food, fuel, and fiber to America if we don't have health care infrastructure? But the $58 billion in additional regulatory cost, We can't do it. So if you want to feed and clothe the American
I think the
people,
gentleman's time's expired. And I'll hear from the gentleman from Georgia, Mr. Ferguson, for 5 minutes.
Mr. Chairman, Ranking Member, thank you so much for the opportunity to address the panel. I thank you each for your time, and thank you all for coming. I'm going to start with a question, and I don't mean it to sound